We are here today with Sameera Patel. She's a teacher here in the King's College, a consultant, and works here in the Maxillofacial Center and Technology for more than 10 years, right? And Sameera, first of all, thank you for your time and your patience in having me here. Um, First of all, I would like for you, if you can, to talk me a little bit about the work that's being done here and the importance of this work.
Yeah, so we basically manufacture and produce facial and body prosthetics for patients who have either come from some kind of trauma, cancer kind of pathway, or are born with a congenital disease, congenital illness. So, patients born without ears, without eyes, and also quite a lot of patients from like I said, like trauma and things like that. So we manufacture the majority of head and neck prostheses in London, but that's not just limited to head and neck. We also include some other body parts as well. So we may often do digits, partial hands and feet, as well as providing, nipple and breast prostheses for patients who might have had cancer, implantology, implants, silicone implants, which might be inserted under the skin for any kind of like divots. We also help with like some complex surgical planning, so making specific guides, implant guides for surgeons to assist in the operating theatre. It will help decrease the operating time and ease the surgery along as well. We also do orthognathic planning for patients who have a skeletal deformity, so patients who might not be able to have their teeth fixed with just braces, for example. So we do complex planning for that. We do a lot of 3D printing in our department as well, and that is across all of the different specialisms in maxillofacial and craniofacial technology.
One other question. When I think about maxillofacial processes, it's a process that most of all, I feel like is less life-changing for the patient. How do you see this process here and the importance of those processes to the patients for the life of them? And if it is free here, how it is the process of cost also?
I think the most important thing is patient outcome. From the beginning of my career, I've always been very, very enthusiastic in making sure that any of my care is patient-centered care. Very thankfully, we have the National Health Service, the NHS, more formally known as, in the UK. So this service is offered across the whole of the UK for free to patients. In that they will not need to pay anything towards it. So they're able to come and from the beginning of their treatment, able to get the treatment as often as they need, whenever they need, completely free of charge. And I think because we have that, we're able to provide like a really good service, a really good high quality of care to the patients. When you're treating patients for a maxillofacial prosthesis, you need to think that a lot of these patients might not have even left the house in a few years because they're so nervous, they're anxious. Losing a body part or a facial part is a big part of your identity. And so being able to give that back to a patient, I think, like you said, is absolutely life-changing. And sometimes the patients don't even realize how life-changing it can be until they actually receive it. Some patients will not be quite decisive in whether they want a prosthesis or not until they go through the process. And then when they finally receive something that restores a missing body part, gives them some dignity back, gives them some quality of life back. And it's not just aesthetics. The majority of the time it's aesthetics, but we also provide prostheses which give function back to the patient. You have patients who sometimes can't chew correctly because they don't have a denture, for example, and they don't have a nose, or their nose is missing, or there's a part of their cheek missing, and they're unable to retain fluids and things. So it's not just about making someone look more dignified. It's also a very psychological, very mental process. And I would say from the clinician's point of view, it's obviously extremely fulfilling when you're able to give someone back that quality of life, when you're able to ensure someone can live the rest of their days with dignity with their family. They can go out and socialize again. They can go to the shop to buy some bread and some milk, which they couldn't do for 3 years because people would stare at them. They were worried, they were concerned. I think it has a really, really big impact on the quality of life and the mental health of patients. And I'm a big, big advocate for that. And it's really, really lovely to be involved in that from start to end.
Yeah, it's beautiful. I used to say in my hometown uni that we don't only rehab patients, we rehab smiles and lives actually, because you see the before and after of the patients, and it just gives you fulfillment also.
Absolutely. And I would also say, like, it's not something that you just see the patient once and then that's it. We have often very quite long and tedious processes to manufacture something that's suitable for the patient and that they're happy with. At the end of the day, if the patient isn't happy, they're not going to wear the prosthesis and it's not going to be a good outcome for them. And you want to try and improve their quality of life as much as possible. So I would say, especially with our patients, they will need a replacement prosthesis every so often. It's not one and done. So a lot of these prostheses, especially as a clinician, if you're working in one place for a long time, you will see this patient for the rest of their life. And to be able to see that growth and see the change and be able to be a part of that, you end up forming a very, very intimate relationship with the patient. A lot of patients become friends when you're seeing them for such a long time. You're spending so much time with them on clinic. You're asking for their input. So it's a very specific kind of job for a very specific kind of person.
Yeah, after a while you feel like you're a bit of friends with the patient. You're
Absolutely.
learning about his life, and what he's doing. It's so nice.
Of course.
Last but not less important, one thing that is really important and how it is for you, the importance of funding in this whole process, not only of research but of clinic, because as you said, it is free. So how this process of funding and getting grants is important here in the center.
Well, thankfully in the UK, we have STEM subjects, science subjects are funded, but trying to apply for these kinds of funds and grants and scholarships, is also a very laborious process. It can be quite disheartening sometimes. You have to apply for 5 or 10 grants before you actually get one that is successful. But when you do get that one, that's all you need. You just need someone to believe in the research that you're doing, someone to trust that the money that they give you, that they offer you, is going to be spent in bettering the future of clinicians, the future of patients, the future of research, and the future of MaxFac. And I think a lot of that is very tied to a lot of stem cell research, 3D printing research, CAD research as well, and also research and funding into teaching the next generation. In the UK, we don't have very many maxillofacial prosthetists. There are about 150 of us in the whole of the United Kingdom, and that's a very, very small number. A lot of our profession are getting very close to retirement age, so we want to encourage students, encourage people to come into this profession, encourage the teaching. King's College London, for example, offers one of a very elite course in maxillofacial and craniofacial technology in the world. So we have students from all over the world. So it's amazing that we're able to give back in that respect, able to provide students from other countries, professions and clinicians from other countries, to take that back and then expand that and fund into the research in their own countries. And it increases collaboration. Even just meeting you today, we've already talked about the future and how funding can help the future of MaxFac and technology. So yeah, I think it's absolutely important. The NHS is struggling in the UK, you know, there used to be a lot of funding into it, which there isn't anymore for various reasons, you know, management politics and the government and you know, all of the things like that. So I think it's really important to appreciate what we do have and put as much as we can into it before one day, you know, it might not be here. We've had the NHS for a very long time, and I think it's definitely important to continue in that area. You know, it's very easy for, you know, people to qualify in certain fields, especially in medicine and dentistry, and then, you know, do like private work and go abroad and, you know, make money. And that's, you know, it's all well and good, but like I was saying to you earlier, one of the biggest reasons for getting into a profession like this is because you care about patients, and you get a real sense of joy and fulfillment from giving someone that quality of life and care back. And it you know, you can have the hardest 2 or 3 weeks of your life where it's really busy and you're working all day and you're really stressed, and then you have that one patient, and you know, it's like everything was absolutely worth it, because at the end of the day you've made and given someone a future which they might not have thought that they had before. So yeah, I think funding is extremely important in especially in this kind of area.
Yeah. Well, Sameera, thanks for your time.
Thank you so much.
It was nice to have the
It
day
was
here with
lovely to
you.
meet you as
I
well.
learned a lot.
Amazing. It would be good to have you back someday.
Yes, for sure.